Madam, shall we start, madam?
Yes, yes, sir. Yes.
Yes, madam. Very good morning to one and all. Welcome to today's Talent Search webinar program series supported by DST Karnataka. On behalf of KSTA and on behalf of all the teachers and students who have joined with us today and who will be watching this session live in the YouTube channel, I welcome you all. And I welcome today's speaker, Dr. Lata Mullur, madam, and senior Dr. Kushal Das, sir, and my colleagues, Shri Vikesh Srinivasu, and other students and teachers. Welcome. Before starting today's session, I would like to give a brief introduction about Dr. Lata Mullur, madam. She has completed her MBBS, MD, and PhD CME, and currently working as a professor in the Department of Physiology. And she has guided many PG and PhD students. Her area of interest are cardiovascular physiology, yoga, and medical education. She has total experience of 18 years in teaching and medical research. Her medical education, she is a medical education faculty since 2013 to 14 and have actively participated and delivered many talks, organized workshops, and training programs. She has successfully completed MCI recognized basic and advanced medical education course and awarded PhD under the guidance of Professor Kushal K. Das and Dr. M.S. Biradar as co-guide as her research area under in the cardiovascular physiology. She has 18 years of experience in UG teaching and 4 years of in PG teaching and completed many research works and also many ongoing research works. Research projects guided 8 UG students as STS under ICMR and BLDE University. She has published many national and international of journal repute, more than 20 publications and many book chapters. And she has presented at various conferences, CME and workshops. She is a joint organizing secretary of Physiology National Seminar in the year 2014 and joint organizing secretary of Physiology National Conference and so PyCon in the year of 2016. She is the organizing secretary of International CME in Medical Education and convener of International Hypoxia Symposium, and she has delivered many guest lectures. Apart from this, she has many roles and responsibilities. Has worked as a deputy coordinator IQAC, BLD Vijayapura, vice chairperson of cultural committee and editorial member of BJHS, member of board management since 2017, and active member of committee for women empowerment and member of BOS physiology, member of institutional mentor, EC member and member of students and member of ad hoc committee and student council and core committee and worked as an organizer at various platforms for state, national and international conferences in CME's convocation being conducted at institute and university. He has received many awards and accolades. Research Day Gold Medal for Best Poster by BLDE in the year of 2018. And she is carrying out many research projects funded by BLDE and ICME projects. With this brief introduction, I welcome you once again, ma'am. Thank you for accepting our invitation. Over to you, madam.
Thank you, sir. Thank you so much. Rakesh, share. Sure. Very good morning, sir. Thank you so much for your kind words. And is my slide visible, sir? Hello?
Not yet, madam. Not yet, madam.
Okay.
No, the slide is not visible.
Yes, sir. Yes. I'll Is it visible now?
Not
No,
yet, madam.
no, not yet.
Just a few seconds.
Okay, ma'am.
Sharing and person.
Either you can share through screen or through that presentation application, madam. PowerPoint.
Yes. Yes, sir. Yes. Is it visible now?
Yes, ma'am. It's about to come.
About to visit, not yet come, but it looks like something.
Next slide.
Just change the slides, then we'll know.
Yes, sir. Yes, sir. Is it visible now, sir?
No.
I changed the slide. I changed the slide.
No, it is not showing anything. Only white background.
Still
Okay.
a blank screen, ma'am. I think it's
Okay.
taking time to load that presentation.
Yes, yes. Yes. Showing sharing. Is it share?
Again, though.
What
Is
you
it
can
visible
do-
now, sir?
Not yet, ma'am.
Yes.
Not yet.
Oh, okay.
Current sharing.
Yes, ma'am.
It has come.
Okay. Okay. Okay.
Go to screen share.
Yes, sir. It's taking little time, sir.
It's okay.
I think it's just taking upload
Yeah.
time.
Yes,
Right,
ma'am.
it's
Now
okay.
it's perfect.
It is fine.
Visible
Go
now?
ahead.
Visible.
Yes, ma'am.
Okay.
Yes,
Okay.
Thank you.
Okay. Sorry for that technical interruption. Very good morning to all. Thank you so much, sir, for your brief introduction about me, and thank you for giving me this opportunity. So I think audience will be 12 past students. So I'll be addressing them regarding their career path. So they are standing right now in the crossroad where they have a lot of options, way to go. They are having a confusion. So I'll be taking them through one of the path regarding which I'll be sharing with them their career in medicine, how it goes, and what are the scopes and challenges they have in this particular path. So I'll begin with little history of medicine. So how it evolved over the period of time since BCs. So there is a lot of change happened in the treatment modalities, diagnosis. Then there is a development of the vaccines. There are a lot of drugs developed, and many treatment modalities have developed by the contribution of a lot of scientists, researchers, and Nobel laureates, which has ultimately led to increase in the life expectancy of the person, which was nearly 30 years of age before the vaccines of cholera or smallpox or any other things. The people used to die at very young age because of lack of treatment and lack of vaccine and all. With the development of these drugs for the treatment, vaccines for the many infectious diseases, the person start surviving for longer time. Now that there is a lot of advancement in the technology, and there is a lot of increase in the treatment modalities, which is helping the person to live longer. So this is a contribution of the scientists and researchers for overall in improvement in the lifestyle. So career in a medicine is often of most respectful and rewarding professional worldwide. So medical professionals play very crucial role, as I said, they contribute in the identification of the disease, in treating the disease, and also they help in preventing the disease and overall improving the quality of life. So according to the WHO, the World Health Organization, it says that one doctor is required for every 1,000 population. So this is very true and holds good for every country. If we see this graph, we can see that in other countries, there is sufficient number of doctors. But when we come to India, we are still lacking. We are not meeting up that WHO doctor-patient ratio. So there is a lot of requirement of doctors in India, maybe because of increase in the population, etc. So if we see these picture depicts the number of medical seats available in various states in India. So total we have, this is a last year statistics, which shows that there are nearly 83,275 medical seats are available. But if you find the number of aspirant students who are competing for these many seats is more than 1.59 lakhs. So there is increase in the demand. There is lot of competition for these seats. Even in spite of increase in the number of medical college, increase in the number of seats in the MBBS, there is lot of lacunae in the existing seats and the demand. So there is so much of demand for the medical seats. So once the students takes up the medical career and they complete the medicine MBBS course, the they will be called as Indian medical graduate. And Indian Medical Council expects certain things from these Indian medical graduates. So those will be mainly, he has to be a clinician. He should be diagnosing the disease, he should be treating the patient, and also he should contribute to overall well-being of the patient by educating him regarding the hygiene, healthcare, and other aspects. Next thing, the doctor is expected to be a good communicator. He should be a very good communicator in terms of patients or patient attender or even with the colleagues. He should be very good speaker to his own colleagues also, and he should be able to convince the patient attenders, his relatives in terms of treatment, treatment outcome, everything. So one has to be very good communicator. The next thing expected is about he should be a leader and team member, because in healthcare it is not individual job. You require a lot of people along with you. If you want to conduct a simple surgery, also you need anesthesiologist, you need a nurse staff, you need a supporting technical staff and all. So there you should be leading a team very effectively, and also you should be part of a team member, and you should be taking care of whole team and carrying out your task very well. So for that you should become a leader. Then you should be a lifelong learner. The medicine we get every day new and new techniques, new treatment modalities, so many new updates will be coming every day. So you should be open minded to learn new things. So you should be a lifelong learner. Then you should be very much professional towards your behavior. You should follow the ethics and all those things. So these are the 5 things expected out of Indian medical graduate after you complete your MBBS course, mandated by the National Medical Council. So coming to the training period and time distribution of this MBBS course, I'll talk about the course first, then I'll tell you the scopes, what you have in this particular medical field, if you choose it as a career. So this MBBS course is mainly of 4.5 year duration, phase 1, phase 2, phase 3, part 1 and part 2, and 1 year of compulsory internship, medical rotational internship, which is carrying out to be a total of 5.5 year to complete your MBBS course. After that, you will have post graduation, then super specialty, then if you can go for fellowships and other things. So this is only regarding the MBBS course. So this MBBS course, 4.5 year, includes study of these many subjects. In first year, first phase of your MBBS, you will be studying 3 subjects, namely anatomy, physiology, and biochemistry. This duration of this course is 1 year. Then next second phase or second year will be having pathology, microbiology, and pharmacology, 3 subjects again. Again, the duration is for 12 months. In third year or third phase, part 1, again duration is 1 year. You will be studying forensic medicine and toxicology and community medicine, or it is PSM. It is also called as PSM. In phase 3 only, part 2, and you will be studying about general surgery, general medicine, pediatrics, obstetric and gynecology, ENT, ophthalmology. This will be for the duration of 18 months. So after completing all this, you will have 1 year compulsory rotatory internship in different departments. Once you complete your internship, then you are eligible to get the degree of MBBS. After you get a degree of MBBS, you have to go for SRship. Then you will prepare for post-graduation and enter the post-graduation. That is again, the duration will be 3 years. You can go for MD or MSs in any of these selected subject. You can choose any of subject and do the specialty or post-graduation in that particular subjects. That will be duration of over 3 years. After that, you can opt for super specialty. You can do still more in-depth study about cardiology, nephrology, or any other subjects you can choose of, and you can do the DM or MCH again for the period of 2 years or 3 years. After that, if you want to have a much more depth knowledge, you can go for fellowships and so on. So this is how the medical course go on. Then, so for this program, when you are attending during the MBBS course, your attendance has to be mandatorily more than 75%. It is minimum of 75%. You can attend even up to 100% in theory, whereas practicals, it should be more than 80%. Attendance is very, very mandatory. Otherwise, you will not be eligible to attend your examination. So this is very, very important to maintain your attendance during the MBBS course. Then how is the distribution of marks for individual subjects in the MBBS course? So most of the subjects have 200 marks for theory paper and 100 marks for practicals. This holds good for first year and second year. Whereas in case of third year, you will have 100 mark paper in forensic medicine and toxicology. Community medicine have 200 marks. Again, ophthalmology and ENT will have 100 marks. Pediatrics also will be 100 marks theory paper. Rest of the subjects will be for 200 marks. Whereas practicals will be 100 for rest of practicals except general surgery, general medicine, and obstetric and gynecology, wherein you will have practicals for 200 marks. This practical includes performing the practicals or clinicals along with your viva-os. So you will have to attend both practicals, viva-os after completing your theory examination. Then your passing criteria would be during the internal examinations, combination, that is both theory and practical, you should get 50% marks to be declared as pass. Minimum of 40% is essential to become eligible for university examination. Whereas during university examination, there is a mandatory 50% marks separately in theory and practicals. Practical include practical or clinicals or plus viva. So this is how examination pattern goes, and passing percentage is this. So after understanding the duration, passing percentage, and also the period to which and what are the subjects you are going to learn during the MBBS, I'm going to talk about there are a lot of scopes in medicine. You can become a clinician, you can become a researcher, you can become a teacher. There are so many scopes after you complete your MBBS. What you want to do, I am going to highlight certain aspects in this topic. You can choose accordingly what you want to become later on. First scope is to become a clinical practitioner. Once you finish your MBBS, you can directly become a clinical practitioner. You can register yourself under the medical council and you can start your practice. So what are the options under this? You can be a general practitioner who will basically treat many common illnesses. You can become a family physician or general practitioner, or you can become a specialist. You can choose any other subjects like surgeons, cardiologists, neurologists, endocrinologists, and any other expert specialty you can choose and become a specialist, and you focus on those particular diseases only. Or you can be a pediatrician who treats the infants or children and adolescents. You can try to become a pediatrician, or you have an option of becoming a geriatrician who will focus on illnesses of the aged person. So these are the options under your clinical practice. Then you can choose to be a surgeon. Okay, so again, there are surgical specialties wherein you can become a neurosurgeon, orthopedic surgeon, plastic surgeon, or cardiovascular surgeon. The choice is yours. You have so many options when you become a surgical specialist. Or you can choose to be a researcher or academician. Research in terms of you can develop new treatment modalities, you can develop new drugs or find out new drugs, or you can find out new technologies for the treatment, etc. In this, again, you have two options. You can become a clinical researcher wherein you will be conducting a studies to develop new treatment and therapies, or you can become a basic science researcher wherein you will be investigating disease mechanism at a cellular level. So these are the two options if you want to become a researcher, or else you can have other option like becoming an academician. You can become a medical teacher wherein you can guide or teach the uh, future healthcare professionals. Here also you have so many options, like you can become an administrator, you can become a heads of the departments, and so many options are open for you. Next option is public health or epidemiologist. So what you can do here is you can choose to be a public health officer, which focuses on prevention of the diseases, who will develop lot of health policies and focus mainly on community health. And these people will be working with a global health organization such as WHO and CDC. Or else you want to become an epidemiologist who will focus mainly on a particular disease pattern and outbreak to implement preventive measures. Recently, we have seen the outbreak of COVID. So you can specifically choose to be like epidemiologist to try to find out the outbreak of such diseases and find a preventive measure for such things. Or you can become a community health worker who will provide or guide the community people who are underserved. You can educate them, you can guide them regarding the outbreak of the many diseases, and tell them about sanitization, tell them about the hygiene, health hygiene, food quality, water sanitization, everything you can guide them being a community health worker. Next option is alternative and complementary medicine, wherein it includes Ayurveda, homeopathy, naturopathy, and acupuncture. So far, I spoke about the allopathy people. Now, you can even become a Ayurveda doctor or homeopathy. You can choose a naturopathy or even acupuncture treatment also. These things are growing acceptance worldwide and a complementary approach to the traditional medicines. So this is another option you can go for alternatively if you are not getting a seat in the medical branch. Then there is option of allied healthcare profession, wherein you can be a nurse practitioner. You know that the under the physician, the lot of nurses will be working. So next to the doctor, they will be treating or directly in contact with the patient. So you can choose to be a nursing faculty and work under physician and directly taking care of the patients in even during presence or even in the absence of the doctors or a physician. You can also have an option of becoming a physical therapist where wherein after the accidents or after the surgery, there will be some disabilities in the people. You can become a physiotherapist, rehabilitating a patient with physical impairments, or there is another option of becoming an occupational therapist who will focus on functional abilities and day-to-day daily living skills. Okay, they after the accidents or after the surgeries, some people may lose the functionality or mobility of certain parts of the body. So you can become a trainer or therapist of these particular skills. Next option is like along with the science, if you have interest or curiosity towards the technology, there are options of becoming a biomedical engineer or biomedical informatics, or you can artificial intelligence in healthcare, or you can be part of the team who will develop a lot of devices for this medical equipments or something like that, or robotic surgery, or you can involve in the telemedicine applications. This is another option if you are interested being a medical career in the medical career, and the technology also if you like. This is a option for you. Another option for you is you can, after completing your MBBS, you can go for emergency medicine, do your three-year MD course there, or you can do the emergency medicine in specialty wise, and then involve in critical care and surgery during the disaster management or emergency situations, or provide emergency medical assistance during the crisis like the floods or even during the earthquakes. There immediately the medical facility is required, so you can join those teams and provide the services. So if you once you become a medical professional, the main motto is to provide the services. There are many ways as I am highlighting here. There are many ways to provide your services. According to your interest, you can be part of any of these teams. Then if you want to be a administrator or policy maker, that is also option. So there are courses like MPH and MHA, which means MHA is a hospital, a master in hospital administration. MPH is masters in uh, public health. So you can go for that also. After doing that, you will be a part of hospital administration and healthcare management. Then you will be a part of team of policy making team, or you can become a hospital administrator or healthcare policy analyst also you can become. So if you are interested to be administrator, these are the choices for you. So along with any uh, scopes, there follows the challenges. So as you have n number of opportunities here in medical field, if you choose it to be your career, there are also a certain challenges which you will have to face day to day, or you will have to overcome, or you will have to be prepared to face these during your career. So what are those challenges? I'll briefly highlight them. First of all, the course is very lengthy and demanding. Okay, so this picture I have shown is not for Indian thing. Many countries have different length of period of this medical education. So in India, as I said, it is about for 5.5 year MBBS, then 3 years MD or MS, then you will have 2 years of MCH or DM, then you will have fellowships for 1 year or 2 year, like this. It goes on. So the duration of course is lengthy. It doesn't stop once you finish your MBBS. You will have to be a specialty, you will have to be a super specialist, and you will have to have in-depth knowledge about any specialty you do. Okay, so it is lengthy course demanding a lot of your time. Next challenge is you will have intense workload and long working hours. So once you are working under any physician or clinician as a part of healthcare team, you will have long working shifts. You will have night duties, weekends, holidays also you will have to work, because patient illness cannot come on working days only. Even on holidays, the patient comes. If they have undergone surgeries, you will have to monitor them till they recover. If you have to monitor them for their recovery, you will have to be besides the patient, and you may not get holidays. You may not get breaks for even sleeping or having the food or something like that. So you will be working under high pressure situations. especially when you have some emergency or critical care to be taken. So these are the things you will have to face when you are in the healthcare system. Then you may be exhausted emotionally and psychologically because you will have to deal with the patient, his situation, his emergencies, his complications, along with the convincing the patient relatives and your whole team. You will have to convince your own team regarding the treatment and all. So during this, if the things are not going according to your will and wish, then there will be mental fatigue, you will be emotionally disturbed, you will be irritable. All those things are possible when you are in the health team. Then you will have to be very careful whenever you are practicing. Nowadays you are seeing a lot of people are like attacking the doctors if something goes wrong, whether it is knowingly or unknowingly. If something goes wrong, even though you have followed every ethics and law, there is no malpractice. If patient does not survive, the people think that you have done something wrong. So you have to be very legal and ethically follow the things, and confidentiality of the patient have to be very much followed, and you have to adhere to the medical ethics and laws. And once you complete your degree, it is not the end. So it is ongoing process. Learning is an ongoing process. As I earlier mentioned, you have to be a lifelong learner. Okay. So there are a lot of inputs coming day by day in the medical field. There are newer things coming up every day. So you should be educating yourself continuously, and you will have to undergo trainings regularly, and you will have to attend seminars, conferences, workshops very regularly to update yourself, to upgrade your skills and enhance your knowledge. Okay, these are necessary and you must go for all this. So learning never stops. It has to be lifelong learning. There are a lot of risk also when you are treating the patient. During COVID, we saw a lot of nursing staff, lot of doctors we lost because they directly exposed to the COVID patients. In spite of taking a lot of care, in spite of wearing the PPE kits, so many doctors, especially if their immunity was down, many nurses, they have lost their life. So such exposure is very much expected or predicted in healthcare system. So you will have to be very careful. You will have to be very strictly adhering to the hygiene and safety protocols have to be very much followed. During this very busy schedule, you will have to find your own time for the self as well as the family. So work life balance is very important issue when you are very much busy with the patient care and all. So it has to be balanced. You have to take time for yourself, you have to give time for family, but family also has to understand your situation. So all this balancing is very important and very essential. So as I said, the course is lengthy, but not only that, it is also having high tuition fees. There might be a financial burden for the students as well as the parents. So this is one of the hitch wherein most of the students cannot afford to pay for the medical education. They will choose to be a nurses, choose to be a allied health sciences, wherein the fees compared to the medicine is lesser there. So I have told you so many scopes you can opt for. If you want to like doctor medical field only, then you will have to pay high tuition fees. So especially in government colleges and all, fees will be less compared to the private institutions and deemed to be universities. So you can score a high rank in NEET examination and you can go for government colleges and all to fulfill your dreams. So apart from these scopes and challenges, there are certain things you must remember when you are choosing the medicine as your career. So first of all, your personal interest. So you have to focus on your personal interest, what you like, what specialist you want to become. That you should be very clear before joining on itself. And skill set is very important, whether you prefer to be a doctor, treating doctor, or you want to be a researcher. That you must be very much deciding at the earlier stage only. And you should think about your work-life balance also. As I said, it demands a lot of your time and energy. So you should be capable of balancing your work life as well as your personal life and family life. And your career goal is also very important, which you want to do specialty in which particular area. You want to be an administrator, you want to be a leader, or you want to be a clinician. That you should decide upon, and then you should go ahead with the choosing the career path. So this career in medicine is though noble, and it is very much demanding, offering immense opportunity for growth and contribution to the society. While challenges can be daunting, the rewards, both financial and emotional, make it fulfilling the profession. Those who choose this path must be prepared for continuous learning, resilience, and unwavering commitment to patient care. If you are passionate about making a difference in people's life, medicine is a career worth pursuing. So, before concluding, I just want to say that the journey to become a doctor or a healthcare professional is long and challenging, requiring dedication, hard work, and resilience. So, with this, I wish all the best for the people who wish to choose this as their professional career, and be ready for facing the challenges and be prepared which path you want to choose. So, with this, I would like to thank the KSTA for giving me this opportunity to share my views on the career in the medicine, the scopes and challenges. Thank you so much, sir. Thank you. Thank you, one and all.
Thank you very much, madam. Indeed, it's a service-oriented career. Uh, Patience and perseverance is always required for this field. Dr. Kushinda, sir, over
Yes.
to you, sir.
Yeah. Thank you very much. Yeah. Thank you very much, Dr. Lata, for this
So thank you
excellent
so
talk.
much. It's my pleasure.
This is excellent speech and talk, lecture, and this is really eye-opening for many of the would-be medical student in future. Choosing a subject at the time of 10 plus 2 when the age is around 16, 17, 18 is very
Yes.
difficult. It's very difficult in our country because it needs little maturity for
Yes.
understanding that how much one can afford. You have touched almost all the points, including the financial aspects of this, which is a burden, no doubt
Yes.
about that.
Definitely.
Although many banks and others, they come forward for support and give the student loan, but that may not be adequate for many of the places because running expenditure is a long term, because
Yes,
it
sir.
is 5.5 years course.
Yes.
And then after the career and during this time, and examination is the national NEET exam, national base test, and one single window, and that makes the one entrance, and then it distributed all over India. And
Yes.
state, although state is having certain, all the states have this separate this one counseling, but that is only for counseling, not for the examinations. Selection of the student by the merit list published by the MCC. So this is one window platform by which one enters. So nationally it may be distributed. So that required the hostel expenditure and other expenditure also goes. Even though student may got a medical seat in a government medical college in Kanpur from Bangalore, it has to stay there and do it because that is the rank. So definitely getting own state to get a good rank, one has to
Yes,
score
sir.
very good. That you have
So
highlighted.
if they are getting in other colleges, other
Uh,
states, apart from the challenges what I mentioned, they
uh,
even face the problem of language, culture,
Yeah, that is
diversity,
always
what we
there.
have in our India. So
India.
that is also one challenge they can
Big challenge it is.
come
The
across.
nation.
Yes. Yes.
This is the only course apart from the IITs, except IIT. This is the only course medical professional where India national-wise distribution, where as you mentioned, culture, language, and food habit, many
Food
other things
habits. Yes.
matter.
Yes. Yes.
Student 10 plus 2 just do not just be thinking that superficially about the medical to get a big this thing and all. It is really challenging. I think the second part of your talk was challenging. Challenging part is actually more serious.
Yes,
Course
sir.
you may join and you may complete, but the challenging part to accept, and that will be very, very this one. And it's a very stressful profession.
Yes, very stressful.
Even after the healthcare of own doctor themselves or
Yes.
himself and herself is often neglected. And that is one
Sometimes
of the
they'll have a duties for more than 48 or 72 hours
yes,
continuously.
yes, even the
They'll be
internship
physically, mentally exhausted. And
exhausted.
such situation we are seeing in emergencies and
Absolutely, and even their internship when they will be after university degree acquiring the MBBS, but still they are not licensed yet to get the practice and actually call them as a doctor. Required an internship, which you have clearly mentioned. This internship 1 year, they have to get a training of the day and night, the duty
yes,
schedule. And post graduation, it may be 72 hours, even 1 week night duty continuously, and there will be 24 hours duty. This is not like that the night duty and day off. Doctors in post graduations, their day off, there is no day off. Night duty
yes,
means it is an extra. So this is a big challenging student, and at 10 plus 2 at 18 years must think
yes,
of your future in a very different way. It is not that easy. So you have highlighted excellently these points and all. I think the 10 plus 2 PUC students of our states will be benefited by your speech and your lecture, that how it can be benefited and all. So thank you once again, and thank you, Dr. Ramesh, and thank you, Dr. Lakshman, and all, Sikant, and all everybody for this opportunity you have given to our university. And thanks a lot. It is a great speech, and I hope the students will be benefited with your talk. Thank you very much. Over to KST.
thank you, sir. Thank you so
Thank
much,
you
sir.
very much, sir. Indeed, it's a long collaboration and a long way to go with BLDE, and your support and cooperation we require in future also, sir. Madam,
Thank you.
thank you very much.
Yes, sir. Definitely,
And
sir. It is our honor.
major of the question from the audience is related to internship, madam.
Yes, sir.
So they will get it into internship. Is it a
Yes,
mandate, and what are the roles and responsibilities they have to manage in the
yes,
internship, and what are the
yes,
benefits of that? This is the one
yes, sir.
major question that you can answer.
Yes, sir. This 1 year in rotational internship is very much mandate. Unless you complete this, you will not get the degree certificate. So it is mandated by National Medical Council itself. So they will have to, they will have a different, they will spend different periods, like 1 month or 3 months or 2 months in different departments, wherein they will be learning the skills. Because during their course, they will be studying theoretically. Here they will have duties. They will get to learn hands on, and they will be they'll be taught to assist the surgeons, and they will have night duties, and they will learn a lot of things. Practical things learning will actually happen during the internship. So their skill enhancement, skill development occurs actually during the internship. That is mandatory. They have to undergo this, sir. I hope I have cleared my point.
Okay, madam. So what will be the roles and responsibilities they are asking? So
Okay.
that you can
Uh,
tell.
like
And
they
benefit.
have to, yes, they have to be in part of, like any, like if it is a surgery, they have to be part of that team. They will sit in the OPDs, outpatients, they will be checking, they will admit the patient, they will follow up the patient as per the guidance from the senior doctors, and they will post the patient for the surgery. They will look after what the prerequisite preparation has to be made as per the surgeon's guidance, and they will see patient shifting, all other instructions are given or not, informed consent is taken or not. So these are the responsibilities, and post-operatively, whether patient is recovering fast or not, anything he has to follow and update to the surgeon. I'm just giving one example. And they will accordingly suggest certain things, and the interns have to follow and get it done through the nursing staff. So these are the responsibilities and roles they have to do. If the patient is not recovering in time, they have to be besides the patient monitoring the blood pressure, vital things they have to monitor, and they have to be along the patient till the recovery of the patient. And they should be communicating with the patient relatives also, like about the status of the patient, what is happening exactly. So these are the responsibilities of the interns.
Thank you very much, ma'am.
I just want to add one more point here.
Yes,
This
sir.
internship time, the students, they will be actually learning the team working, because their teams of their own batchmates will be in the radiology, some will be in the medicine, some are in the surgery, some are in the pathology, some are in the OBG. The patient came from one side and they have to run around with the different, because they may require the disease and the concern issues may require the multiple support from the doctors. So this intern during this time, they are actually asked to go and interact and get the report. So report and get the opinion. So they go and note it down and comes. So they also get support from their own colleague in posted to other department, and it is a rotational internship. So a very big teamwork doctors they learn, and throughout the life of a doctor, they work in a team. The team of doctors along with the nursing staffs and supporting staffs, and they jointly they work in such a way, this type of education, I think that rarely found in any other education system in our country or any other country except medicine, where a joint team network for coming to a conclusion, it comes. So that's the reason this will be learning and beginning at the level of the internship. They will learn, it starts learning of this process, which is lifelong, as Dr. Lata mentioned. Thank you.
Thank you very much, sir, for value adding your inputs in the in answering audience questions. I would like to conclude now. Thank you very much, ma'am, once again for being part of this program. In future, also we need your support like this. And
Definitely.
we invite you to visit our KSTA Bangalore office once. So
Definitely.
there will be many physical programs happening.
Surely,
So
sir.
you can be a part of that. And I also invite Dr. Kushal Das sir to our Bangalore office once. It's a long time we have been to BLDE. We have met Kushal Das sir and other staff. And thank you very much, ma'am. And also I would like to thank all the audience who have joined with us. Hope to best wishes to all the students for their exams and careers, and wish to see you one more last session related to this talent search program. Thank you very much, ma'am. Thank you, sir.
Thank you so much. Thank you so much.
I will share you the YouTube link, madam.
Okay, sir. Thank you.
Thank you.